A very, very good morning, good evening, good afternoon, and namaste to everyone who is joining us here today for our live webinar. I'm Kalpana, and I will be moderating a conversation with two amazing, amazing women, and I'll be explaining why. As you may see, the topic for today is better hearing and speech. And I would just like to talk a little bit about the significance of that added to what our speakers will be sharing with us today. Each May, the American Speech and Hearing Association celebrates Better Hearing and Speech Month as an opportunity to raise awareness about communication disorders and the role we all as individuals play in life altering treatment. So today we have a conversation with Dr. Kashmira Chavan and Ms. Mohini Shah as we talk about communication, speech, ENT health, and most importantly, connection. I'm so happy to be having the both of you here today with us.
Yeah.
I would like to just take an opportunity to introduce our speakers, beginning with Dr. Kashmira. So Dr. Kashmira Chavan is a full-time consultant ENT surgeon at Hiranandani Hospital, Mumbai. She has been trained in cochlear implants at Hinduja Hospital, Mumbai, and at NYU Langone Medical Center, New York. She has been running a cochlear implant program at Hiranandani Hospital since 2016. She also has a fellowship in endoscopic sinus surgeries and is trained in laryngology and voice disorders at NYU Langone Medical Center. Doctor Chavan is actively involved in research activities and has published a number of articles in medical journals and authored several book chapters. She is also a faculty member at various training workshops for ENT surgeons and audiology professionals. Welcome, welcome. I would like to introduce Ms. Mohini as well. Ms. Mohini Shah is a practicing as an clinical audiologist and speech-language pathologist with different rehabilitation centers. She is clinically certified by the Maharashtra University of Health Sciences and licensed by Rehabilitation Council of India. She is specialized in diagnosis and rehabilitation of various hearing, speech, language, and swallowing disorders. She has been an active participant for detection of hearing impairment in pediatric populations through various hearing screening programs conducted in different states. Also been privileged to serve various children with hearing impairment and other communication disorders through speech and hearing camps in rural parts of India. So, as you all can see, we have such remarkable women who are going to be talking to us about communication disorders and ENT health. And so, with that, I would like to begin with my first question, and this is to Dr. Kashmira. This
Yes.
month,
Tell me, Kai.
this month we are celebrating Better Hearing and Speech Month, right? So to begin,
Yes.
what is the significance of celebrating this in the first place? Why do you think it's important that we do?
Okay. So the Hearing and Speech Month was first started in 1927 by the American Speech and Language Hearing Association, or ASHA. Now, this was to raise awareness to promote the understanding of hearing health and communication disorders amongst the masses. By celebrating this month, it is hoped that we can encourage people to know more about hearing loss, speech and language disorders, and in a way, this will also encourage more people coming in forward for hearing loss screening programs. It will help in preventing hearing loss if people are more aware about the factors that can actually cause hearing loss. And this will motivate people to seek treatment for hearing and speech related issues.
Yeah.
This also is a good opportunity for all of us professionals to come forward and interact with people and make create more awareness about hearing loss and speech and language disorders also.
Thank you so much for that. So I'm also hearing this promoting behaviors that enable people to take care of their speech and hearing
Yes.
health, and also bringing
Yes.
awareness about how the repercussions of having these disorders, what repercussions can they have. Thank you so much. And also added to mention where all of the professionals can come together and take this forward with that cause. Thank you.
Yes.
Thank you.
And one more thing is, if we do that, It helps in early identification and hence
Yeah.
early intervention in these programs. So
Mm.
that's what's more important.
Early intervention. That's a big one. Yes, yes. Thank you so much. My next question would be depending on the pertaining the theme, and this I would love to ask Miss Mohini. The theme for this year is connecting people. What does this mean in the context of speech and hearing issues? What do we mean by connecting people?
So, so as the theme suggests, connecting people means we are feeling by connecting people means like we are trying to get connected with everyone with respect to speech and language and hearing skills. So if anyone has hearing problem or if anyone has speech or language related issues, somehow they get disconnected from the society and hence they start feeling insecure or they start feeling isolated because of their impairments. So the main agenda for celebrating this month, as very well mentioned by Dr. Kashmira, is to create awareness about the different disorders that we look after related to hearing, related to speech, language, swallowing, so that every one of us feel connected, secured, and be with the society. So that is the main theme that we are celebrating this month.
Yeah. And I'm so happy we opened with that because the whole purpose of this is to bring more inclusivity, and that's something that we're always trying to do. Um, and I think that's something that we should be doing: inclusivity and being more welcoming and open for people who have different um, circumstances and different conditions than what we normally
Correct.
have. Thank you. Yeah.
Correct. Correct. Yeah.
And so now, coming into the crux of the matter, Dr. Kashmira, what do
Yes.
speech and hearing conditions entail? Like, what are they?
So we have to look at speech differently here, although all of them are interconnected. But first we have hearing, because hearing is what helps us develop speech and language. So hearing loss can be congenital, that is, people can be born with it, or they can develop and acquire it later on in life. Now, if you have a hearing loss at birth, it may again be permanent, which may be a sensory neural hearing loss, where the inner ear or the hearing nerve connections to the brain, or there are some issues in the brain itself. Or it could be something that is conductive, that is a temporary hearing loss, which could be because of a local blockage in the conduction of sound to the inner ear. So, say a problem in the ear canal may not be formed properly, or there may be some issues with the hearing bones, they may not be fixed and well formed. If a person develops hearing loss later on in life, it could be related to certain genetic disorders also, where the hearing loss may occur in after a certain period of time, or it could be because of noise pollution, certain illnesses, certain viral illnesses such as herpes, chickenpox, measles, mumps. It could be traumatic. It could be an accidental hearing loss. It could be an unknown cause of hearing loss due to which a person may get hearing loss. So that is about hearing. Now, if you are not hearing well, it does affect your speech. Now, when we look at speech, there are two different entities here again. There is speech and there is voice. So, speech is how we speak. So, what I'm speaking right now. And voice is what we use to produce this speech. So, if there is a speech disorder, it could be something like stuttering, stammering. I think Mohini will can elucidate on that later. And voice is how we make sounds. So, your voice may at certain times go hoarse because you scream too much. So that is when you get swellings on the vocal cords. We call them vocal nodules. Or then people can develop certain things called as vocal polyps or vocal cord cysts, etc. Also, you may have a viral illness, say laryngitis, where the entire vocal cords get inflamed. That is, they become red and swollen, and which is why you may lose your voice. So there are multiple causes of speech and hearing loss disorders.
Thank you for elucidating on that, especially how the difference between whether it's congenital or if it's happening later on in life. Thank you so much for that. Yes. Now, Miss Morney, my question to you would be: we looked at what do they entail, right? But can you share with us on what are the different types of hearing and speech conditions? If you could elucidate a little bit more on that.
Okay, so as very rightly mentioned again by Dr. Kashmira, that there are different types and different kinds of hearing and speech related impairments. As mentioned, hearing can be conductive hearing loss. It can be sensory neural hearing loss, depending on where exactly, which part of the ear exactly has been damaged. Accordingly, the type of the hearing loss is diagnosed, and accordingly it is managed. Like mentioned, conductive hearing loss is generally temporary kind of in nature, which is very well managed with either through medicines or through surgical management by the ENT surgeons. And if it is related to sensory neural hearing loss, generally this type of hearing loss is irreversible and hence are being managed well by the hearing devices. And related to speech impairments, there are different kind of speech impairments. Speech impairments can be something like stuttering that we commonly see. Someone whose flow of speech is impaired, is or it is not very smooth, or someone may have articulation. Some articulation speech problem means that the person is not able to talk clearly. Okay. Then there might be someone who might have language related disorders. Either it can be through childhood, or it could be because of any brain damage like stroke or some other brain damage reason, and because of that the person has lost his ability to understand or to speak the language. And then there are voice disorders. Voice disorders can be because of overuse of your vocal cords that we call as the voice box. So when we use them overly, we definitely have some kind of hoarseness or breathiness of the voice. And generally this is found amongst um, uh, people who use their voice most, like teachers, like with lawyers, like with singers. So they generally have these kind of issues. So depending on the disorders and depending on the type of occupation that you practice, you may have different kind of speech and language disorders.
Thank you. Thank you so much for that. I think that's also a very detailed picture on how do we classify these different types. And especially looking at how people of different career paths can have different risk factors when it comes to hearing and speech problems like we're looking at. Um, Dr. Kashmira, I want to ask you, like, now, are we seeing any kind of increase in speech and hearing problems? I think something that we always touch upon
Yes.
on our webinar series is especially looking at the elephant in the room, right? The pandemic. Is there any repercussions we're seeing of that in the context of speech and hearing issues?
Yeah. So the latest data, I mean, the data that was pre-pandemic data, we could say, which the WHO had given us, said that over 5% of the world's population, which means 430 million people, require some sort of rehabilitation to address disabling hearing loss. That is a kind of hearing loss that affects their day-to-day activities. And this includes 432 million adults and 34 million children. So that's a huge, huge number. And this was old data. It is also estimated by 2050 we will have almost 700 million people with hearing loss. Okay, now what has happened is so most of these over if you look at the older age group, the hearing loss incidence is even more. Now, what has happened over the years is obviously with a lot of gadget use, a lot of noise exposure, changes in your dietary habits, your lifestyles, a lot of genetic disorders coming in, etc. Hearing loss prevalence has definitely increased and it is expected to rise further. If you look at the last 2 years of the pandemic, we have seen in our day to day practice that there are people who are suffering from the ill effects of the pandemic. One is we have been seeing post COVID permanent sensory neural hearing loss cases coming up, even though it has been a mild infection. So, say people who are, although everyone says Omicron is a viral, I mean, it's like a vaccine, it's a mild infection. I have personally seen a lot of people who have developed permanent hearing loss post mild Omicron infections. Usually, it comes up around 6 weeks to 2 months later. We have also had patients who have come in with hearing loss purely because of too much usage of headphones throughout the pandemic because of work from home. There are And the pandemic has really affected kids, especially the kids just born before COVID and those born during COVID. That is because they were totally socially isolated. This has resulted in less of language and speech stimulation, less social interactions. We have been seeing a lot of speech and language delays coming up post pandemic. And also, a lot of them did not seek medical help because they were scared to move out, which, fairly enough, in the initial period of the lockdown, everything, access wasn't very easy. So, a lot of kids have suffered. But now, once the lockdown was relaxed, we started seeing these cases of autism, delayed milestones, autistic spectrum disorders coming up. These are children who have had no language and speech and language stimulation, and although the hearing is normal, they have had speech and language delay, including behavioral issues as well.
Right. It is a little I think I mean, at least for me, it's a little heavy to talk about because like we're seeing at how much the pandemic has kind of impacted us and seeing how
Yes.
that's accelerated it even more. Like it was always
Yes.
going to happen with the upcoming, like you mentioned, with the use of technology and overstimulation as well as the lack of connection and communication. It
Yes.
was going to happen, but it happened at such a rapid pace because of
Yes.
the
And it's sad that it's
pandemic.
it's affecting the kids most.
Yeah, yeah. To kind of like understand now now that we've spoken about like these conditions, communication conditions, um kind of looking at the intervention side of it, right? I would love to ask you, Miss Mohini, what is audiology and what is the role of an audiologist yourself? I would love, I mean, since you're also from the field, I would also love to understand how do we incorporate something like audiology into mainstream healthcare or multidisciplinary healthcare? But yes, I would love to hear your, especially since you're from the field. It's yes.
So, an audiologist basically helps us to detect and to diagnose the hearing related issues. Okay, so with multiple tests that they perform. So, the most basic test that they perform on any individual is the pure tone audiometry, with which at different frequencies and at different intensities they understand the person's hearing acuity, and with that we infer whether the person has any hearing related problem, and if so, if the person has any hearing related problem, we understand the degree, whether it is mild, whether it is moderate, whether it is moderately severe or profound. Depending again on the degree of the hearing problem, the solutions and the management options are provided to the person in need, and the referrals are being made. Again, this is the degree. If we understand the person has, say, conductive hearing problem that is temporary in nature, they are referred back again to the ENT specialist for the appropriate management. If the person has sensory neural hearing problem but it may be mild in nature, we do give them certain lifestyle changes. We do ask them to do certain we ask them to take certain medications if the person has diabetes or has blood pressure related issues, or has health conditions like cancer or any other, or tuberculosis or any other medical condition which may aggravate the hearing problem further, then that accordingly, that way that hearing loss is managed. um, Going further, with the type of the hearing loss, as I said, we refer it back to the ENT specialist for the appropriate management.
Thank you. Thank you so much for throwing light on that. I think in our previous conversation before this event, we were talking about how there are some people who only know who an audiologist is when the problem comes. So it's really great to talk about this now so that we can really spread awareness on the role of an audiologist. And now I'm moving on to the ENT specialist, but just the role of what these professions play. Thank you so much for throwing light on that, Miss Mohini. Dr. Kashmira, now
Yes.
you're yourself being an ENT surgeon, what is the role of an ENT specialist and what are the different kinds of ENT testing?
Okay, so when a patient has either a speech language disturbance, or if they would they suspect a hearing loss, or if they know they have a hearing loss, they would eventually come to an ENT, either as the first step or they would be referred
Mm-hmm.
by an audiologist. So when a patient comes in, the first part is asking a good history. That's where we get 90% of a diagnosis usually. So if a patient comes in and tells me I have a hoarse voice since, say, a couple of months, and I'm a teacher by profession, and hearing the quality of voice, sitting there in my chair, I have a mental idea of what this patient might have. It could probably be vocal nodules. If so, the first step is a good history. Or when a patient comes in with hearing loss, we do ask them about how much is the noise exposure. If it's a child, we would try and ask the parents if they could tell us whether they think this was from birth or whether the child got some infection and then this started. The next step would be doing a good clinical examination. So, for example, if the patient has hearing loss and if the patient has ear discharge, we run a quick look at the eardrums, and from that, we obviously have clinical findings. So, I know whether I need to give ear drops, antibiotics, anti-allergics, etc. If I do suspect that there is a, and if the patient tells me there's a hearing loss, and especially if there's ear discharge, perforations, etc., I would get a hearing test. So for us, life is incomplete without an audiologist. Most of our stuff is dependent on them. Like my teacher would always say, 10% is our job, 90% is the audiologist a lot of times. So we do depend on them to give us the right diagnosis when it comes to the degree and the type of hearing loss a lot of times. Now, depending on if it's a voice disorder, say a patient comes in with change in voice, then we would also do something called as a laryngoscopy, where it's a thin endoscope that goes in through your nose or through your mouth, and then we have a look at the vocal cords. So we get a direct picture, a magnified view of the vocal cords, and we know what the problem is. Now, depending if it's a hearing loss, if it's a conductive hearing loss that is with ear discharge and some local infection, we treat it with medicines. If there is a perforation in the eardrum which is not getting better on its own, then we would go ahead and operate and patch it up. If there are other infections involving the bone behind the ear, what we call as the mastoid, we would go and drill that bone and clear the infection. If there are some issues with the hearing bones, say the hearing bones are stuck together, there is a condition called autosclerosis in older people, where I older in the sense not kids, so in younger adults or middle aged or even slightly older people, where one of the hearing bones behind the eardrum gets stuck with calcium deposits around it. So in such cases, we remove that bone, and put in an artificial device, so artificial prosthesis over there. Now, if the patient has a permanent hearing loss, that is a sensory neural hearing loss, they would first be given a trial of hearing aids. And if the hearing aids are not benefiting the patient, then we would advise something called as a cochlear implant, which is an electronic device that is fitted surgically into the inner ear. Or obviously, there are other criteria that we look at, but just a broad overview of that. Now, coming to speech and language, if the patient has a stuttering and stammering, we would look at the causes that this could be because of. So, usually, stuttering and stammering have some psychological background to it. So, it could be stress, anxiety. These patients usually would have some psychological or some social background to it. They would have some stressors there. So, those need to be looked at. And then we would refer them to an audiologist and a speech therapist for further therapy, etc. If it's a voice disorder, say if a patient has hoarseness of voice, if it's just vocal nodules, they would do good with speech therapy, again voice therapy, which would again be administered by the audiologist and therapist. If the patient has something called as vocal cord polyps or cysts, these require surgical excision. It's a pretty simple surgery which can be done in daycare as well, but under general anesthesia, where we remove these polyps and cysts. There are also certain neurological conditions that can give rise to voice disorders. In those conditions, we would probably inject something, Botox or other substances, depending on the condition that there is. So it's a wide variety of disorders and a wide variety of treatment options as well.
No, but that is so beautiful because it opens up so many different pockets for us to
Yes.
understand, what is the scope. Of course, in a 1 hour webinar, I mean, I don't expect that we cover
No,
every
no.
single
Each
detail.
one of them is a different topic altogether. So
Yeah,
yes.
yeah, they are. But what we're doing here is just opening them up, and
Yeah.
thank you so much, Miss Mohini and Dr. Kashmira, for throwing light on that. Um, the next thing I kind of wanted to throw light on, or just explore with you is also to Miss Mohini. What are the different devices that are available for hearing and speech conditions, and what are hearing aids in the first place, and are they enough? A lot of questions in one, but yeah.
Yeah, this is a very, very vast topic and cannot be, as rightly mentioned again, that these are different topics in all together, and we can have sessions in each of them. So, to just throw some light on what are the different types of hearing devices and the speech-related devices, like the name mentions, hearing devices are something that can help us to hear better. Hearing aids are the ones that are electronic devices which receives the sound, amplifies the sounds, and make the person hear in an amplified way. Okay, and if if the hearing aids are not sufficient for the person to hear adequately, then definitely we have another option called as cochlear implants, which is a surgically placed electronic device. And there we are very much dependent on the ENT surgeons, and they help us in placing in doing the surgeries, and then we map the devices so that the person can hear again us adequately. If you ask me, are hearing aids all okay? Like, are hearing aids the only options that can, help the person hear better? Then I would say no, it is not that way. There are many patients who come to us saying that, we bought so expensive devices and still we are not able to, hear better. But at the first place, what I make any person understand is that this is just an aid, and it is only going to help you to understand, or hear the speech, and communication, have good communication participation in different environments. It is not a superpower, or it is not a miracle that will be curing, or just taking away your hearing related issue permanently. So if you are not with the aids, you are not going to hear again. So you have to wear the aids and have realistic expectations from the aids, depending on what type of hearing loss you have, how long you have been having this hearing problem, and what is the degree of the hearing problem. So we have to explain each of the factors very well to the person either, or to the family who is buying the aid for their child. So we have to make all of these things clear, because most of the time they feel hearing aid laga liya, ab sunai dega. So it is not that way. We have to address each all the other factors as well, which can still become hindrance to have good communication, healthy communication with their peers or with their family members. So we have to be thorough with every other thing also.
It kind of reminds me of how many say that, just because you have, for example, BP, it's not like only the medicines are going to fix it. It's everything else that surrounds it as well. So that kind of
Correct.
translates to even AIDS and technology
Right.
to improve speech and hearing conditions. Thank you for that.
Right.
My
Right.
question, I mean, to kind of like my last question actually would just be, we're talking about how there are other things also involved with taking care of our health, right? What are some things we everyday people who do not perhaps do not have any communication like conditions, what are some things that we can do every day, like a habit, or some things we should take care of to prevent the chance of having any complications or illnesses pertaining to ear and speech health?
Yes. So you want me to answer that, right? Yeah.
Both
So,
would be great.
okay.
Both would be great. Yeah, please go ahead.
Yeah, so to begin with, when you look at hearing loss, we can definitely prevent it in a lot of cases. There are certain conditions where it's out of our hands, like genetic disorders or related to certain infections, etc., which may not really work. But the basic things that we could do on a day-to-day basis includes not exposing ourselves to really loud sounds. So when you know you're going into an environment where the sounds are going to be really loud, one is if you can definitely avoid those, but then it may not be always possible. So if it is, wear protective earplugs. So this is true of musicians. people
Oh.
who play drums or people who work in bands. Now they need to do it and they are exposed to loud sounds. So they need to wear those protective specialized earplugs, which are made to order usually, which help them help prevent damage to the inner ear as much as possible. Second thing is when you are, for example, when you're working from home, which is now most people are doing that, right? Post pandemic, a lot of people have just adapted to work from home. Make sure your incoming the volume of the headphones that you use is less than the at least 50% of the maximum volume of the device. Also, do not expose yourself to headsets for a very, very long period of time. Take your breaks in between. Make sure that you keep the incoming volume of your phones as low as possible. Use noise cancelling headphones and headsets wherever possible. That should really help. Avoid smoking. That is most important. Smoking affects everything. So other lifestyle changes as well. So maintaining a healthy lifestyle in general. When it comes to voice, if you are a professional voice user like a teacher, a lawyer, a singer, make sure you take care of your voice. Do not scream, shout unnecessarily. Do not whisper. That is most important. Even whispering damages your voice as well. Make sure you keep your vocal cords hydrated. So keep sipping sips of water every now and then. Take care of acid reflux, which means again maintaining a healthy lifestyle, keeping a gap of at least 3 hours between your dinner time and your sleeping time, making sure you're having small, frequent meals, avoiding too much of caffeine intake. All that triggers acidity. So do what you can. The rest you can't really help much.
Right, right. That was very, I mean, I was pretty shocked when I heard whispering. I thought that would be gentle on the vocal cords, but it's interesting how
Yes.
that also
Yes.
is harmful. Thank you so much. Miss Mohini, do you have anything to share as well on what we can do to take care of our ENT health and just in general?
To prevent delayed speech and language development amongst kids, I would request all the parents to keep stimulating their newborns with rich language, with lot of language, with good and meaningful play. And the most important thing that I would like to advise to all the parents is, please do not expose your kids from early age to any kind of screen time. As much as possible, avoid giving them screen time like TV, mobiles, or any kind of screen time. Engage them in meaningful plays, and I also tell them that as much as possible, tell them stories, because for the first 3 years of our life, listening development happens maximally, which will be really helpful for the kid to achieve academic developments in future. So for the first 3 years, I generally tell all the parents to not expose them to any kind of screen time. Do not give them any kind of active toys, like the mechanical toys, like the remote control cars or anything. Give them toys like blocks, puzzles, rings, which will help them to explore and imagine, and further help in their brain development. And keep talking. The more you talk, the better is the development for the child. So I just tell them, just keep talking as much as possible. Just keep talking to them. So that may help any child from having delayed speech and language development.
Right, right. Thank you so much. It's very interesting to see how for different age groups the need is also different. Like for example, Dr. Kashmira, you were talking about reducing the stimulation, like reducing overload. And in some way, Miss Moni, you were talking about increasing it a little bit, involving them more, engaging them more. So I think that's such a beautiful combination of how we can take better care of ourselves from a young age and also when we're a little bit elder, where we get to, actively, consciously make choices that better our health. With that, I have no questions. I have everything that I thought of coming into this conversation with are all answered. Thank you so much for being a part of this discussion, Miss Mohini and Dr. Kashmira. How before we
Thank
end,
you.
since we have some time anyway, how was this experience for you to be with us?
It
Oh,
was
you're
definitely
muted,
a
Dr.
very
Kashmira. Dr. Kashmira, you're
uh,
muted. Let me just unmute you.
Okay. Well,
Yeah.
okay. So it's nice to interact with people first of all, and most important, we need to spread the message around. the
Yeah.
awareness around hearing loss is still very, very low, in spite of,
Yes.
the entire world. In the Western world, it's still pretty okay, but especially in India, even in a city like Mumbai, we still get children who have hearing loss since birth, and then they come to us at the age of 3 and 4 years. And this is one of the it's the financial capital of the country, and we are dealing with this. I can't imagine what we see in the remote areas here. So the awareness needs to be there. Your child, you need to keep track of, especially in kids. Adults still, they would seek help because they are actively functioning. So it's the kids and the elderly that really get affected. Kids, because parents ignore, some relative will tell them, okay, this kid is going to speak later, he'll speak as he grows up. So if your child is not developing as per milestones, you have kids around you, at least you can compare your kid to them if you are not aware about milestones. But I believe every pediatrician would be aware of their milestones. So it's the pediatricians, the parents who need to be really aware about such problems. And when
Yeah.
it comes to the elderly, it's the other family members who need to take care of them. And if they cannot hear, if they're not communicating well, they need to get them to seek help if they cannot come on their own. These are the two age groups that are really vastly ignored in the country. So, not even in the country, I think worldwide that's a problem, but especially so in our countries. We need to look at that as well.
Thank you. Thank you. Yeah. Miss Mohini, do you have anything you would like to share before we conclude?
No, definitely, it's a very good platform where we are able to create awareness as much as possible related to different hearing and speech and language disorders. And as again, like Dr. Kashmira mentioned, that as elderly, they can still take help in different regions. But related to kids, now that is the reason that we have started also working on newborn hearing screening program, wherein the parent is made aware about the hearing disorders that may be present since birth or may
Yeah.
happen during the course of development. It might be there congenitally, or it might be developing towards the course of the development, and hence the parent needs to be aware about it. So
Hmm.
getting a platform where we are able to create further awareness about the same is definitely really
Yeah.
nice, and we are very thankful for that.
We are also very thankful. I am very thankful. On behalf of Heartfulness Wellness, we just appreciate having this space with you. Thank you so much. Thank
Thank you,
you, our dear
Kalpana.
Thank you,
listeners
Kalpana.
and audience who have joined us today. Um, with that, I think we shall come to an end. If there's any recommendations or any feedback you have for us, you can kindly email us at our website. I mean, at our email, sorry, wellness at heartfulness.org. And we have a lot more of these webinars that come every month. And if you would like to suggest topics or, as I mentioned before, provide feedback or just get in touch with us and connect, you can email us at over here. Um, with that, thank you so much once again, Miss Mohini and Dr. Kashmira. I hope you have a great week ahead and sending a lot of deep regards to the both of you and to our audience. Thank you, everyone.
Thank you.
Yes, thank you.